Thank you, Mr. Chairman. I'd like to thank both you and Ranking Member Neal for bringing our rural ambulance bill before the committee today, and I'm very proud to have worked on this committee with our California colleague, Mr. Nunez. In towns and counties where hospitals and sufficient health care providers do not exist, ambulance services are often the only provider of emergency medical services. In the most severe cases, an EMA or paramedic can be the only medical professional in a community. I've learned that for too many of my constituents, their first and most common exposure to the healthcare industry is in an ambulance. As we continue to work towards meaningful long-term reform, we must provide certainty to the ambulance industry and other healthcare industries with extenders. Expiration of these payments would further erode the rural healthcare safety net. Adequate ambulance services are a matter of life and death for so many Americans, regardless of geography. For rural Americans, the distance between them and the closest hospital can be far, often an hour or more. In an emergency, reliable ambulance services can be the only hope that these folks have for survival. I received a message from my constituents in a county without ambulance service recently. The week prior, her sister-in-law had waited 2 hours for an ambulance. She died during transportation to the hospital in Tuscaloosa, Alabama. In her letter, my constituent writes, "I am not speaking about a privilege to the people in this area, but for a right to emergency services, which has turned out to be a matter of life and death for my family." Mr. Chairman, the timing of today's markup is particularly personal to me and my constituents. We are working right now to save several hospitals in rural parts of my district. One of the hospitals is close to being closed, but due to the help of local resources is staying open. But the hospital operates week to week. My constituents in rural parts of my district deserve their hospitals and local healthcare providers to be close to them and to have services, emergency services such as ambulance services. No person in this country should have to fear what would happen in an emergency if an ambulance cannot reach them. A few weeks ago, I was meeting with a large employer in my county, in one of the counties in my district, and the first question that the business owner asked about the closure of that hospital was how long would it take for an ambulance to reach the plant and get back to the nearest hospital? The answer was over an hour. The reality is, Mr. Chairman, we cannot attract and maintain industries in counties where healthcare providers don't exist or are inadequate. When hospitals falter, the quality of the ambulance and EMT services that keep it's the quality of the ambulance and EMT services that keep industries from packing up and leaving. Ambulance providers cannot continue to provide services in under-resourced counties if they do not have more certainty to their payments. I've been asked if working to save access to rural health care is worth it, as if a hospital is as necessary as a Starbucks. Some say that the impact of rural hospital closures affect enough people for us to be concerned with, and that ambulance providers can fill the void by transporting patients to urban areas for care. I often tell folks that unless we drastically change our reimbursement for Medicare and Medicaid services, ambulances will not be able to continue providing services in rural and underserved counties if we lose rural hospitals and rural providers. I would be remiss by not highlighting that our colleagues, Representative Delbene and Walorski, have been working on the add-on payment for air ambulance providers. These providers are very important to rural America as well, and I want to thank them for their continued work on this. I'm disappointed that we were unable to get the air ambulance providers included in today's bill, but we must continue to address air ambulance providers along with other extenders that matter in districts across America, especially those with rural communities. We must focus on meaningful service delivery reform in our country, and I believe that today's bill will go a long way. To be clear, it is difficult for ambulance industry to deliver savings when so many Americans remain uninsured or underinsured, with ambulance and emergency rooms being their primary point of care. Mr. Chairman, I fully urge all of my colleagues to support H.R. 3729, Comprehensive Operations Sustainability and Transport Act of 2017, and I look forward to it coming to the floor and passing. I yield back the balance of my time.
Thank you. The committee will now proceed to consideration